Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Welcome everyone to our March Patient Advisory Council meeting. As you know, my name is Ruth Tate, and I am the chairperson for the Memphis PAC. The chairperson for the Johnson City is Miss Cynthia Blair. And I'd like to thank you so much for joining us tonight and continue to share and participate for our monthly meetings. And we continue to support and advocate for better care for people with are at risk for heart disease, diabetes, and cancer. We have our guest, Miss Lisa Brown Rogers, with quality project administrator, and she's going to be promoting patient use in a patient portal tonight. And we would like to thank Miss Lisa Brown Rogers for coming tonight.
I will go ahead and introduce myself. So first of all, thank you so very much for this opportunity to speak to you all. I'm super excited to be joining you this evening. Patient care is most certainly one of my values, as well as a big piece of my heart as it relates to my occupation. I work with University Clinical Health, and in my role for University Clinical Health, I am the quality project administrator. So all that means is I assist our executive director with strategizing and operationalizing our value-based programs, ensuring that our patients are getting the best care across our practices and our specialties within University Clinical Health. And one of the biggest things that I was charged with in 2023 was serving on the team to increase our patient portal enrollment through MyChart. And so before 2023, we were utilizing NextGen. And then at the beginning of 2023, we went on ahead and we started using Epic as our EHR, or electronic health record system. So I'm going to go ahead and share my screen because I have a small presentation. And then after the presentation, I'm actually going to use my MyChart patient portal to go through all the wonderful things and abilities that we'll have through that MyChart patient portal. All right, awesome. I see your thumbs up, Gladys. So first of all, MyChart patient portal, and the way that I like to see MyChart is a pathway to patient empowerment. And then also it gives you the ability to have health at your fingertips, right? And so that might seem a little overwhelming because it's like, well, all that information is at my fingertips. Well, while it can be overwhelming, it's also a benefit because if you ever need to look at any of your patient information across different healthcare systems, you're able to do that through MyChart. So with using MyChart, it's a secure online connection to all of your health information and medical care, meaning that if your different doctor's offices or your hospitals that you go and you're admitted to, if they have Epic, you'll be able to see all of your healthcare information in one place. What does that mean? Does that mean that you do not have to call different doctor's offices trying to get your medical records because it's all centralized in one location and it's secure? And today we'll explore the benefits of using MyChart and then how can we empower you to take control of your health journey. One of the things that I like to communicate to my patients, because I am over our psychiatry clinic, one thing that I like to tell them is with you having access to MyChart, you are literally in charge of your health. What that means is you have your ability to message your provider. You have the capabilities of doing medication refills or anything that you need as it relates to your health at your fingertips. And you don't have to call around. You don't have to try to get in and see your provider do certain things because it's all able to be done through your MyChart and you're able to have control of that. So, well, what is MyChart? You say, well, MyChart is a simple portal that everybody, we've done a lot of portals and stuff like that, but what separates MyChart from other portals? Well, MyChart is an easy to use, secure online tool that gives you access to your health information anytime, anywhere from your computer or your mobile device. I know one of the things that I like to communicate to my patients is you don't just have to use your cell phone. If you have a desktop or if you have a laptop, there's a link that you can utilize to go and access your MyChart. And by using MyChart, it allows you to communicate with your healthcare team schedule appointments, view test results, and manage your prescriptions all from the comfort of either your home or your cell phone device. And when you think about the climate that we're in today when it comes to technology, it just makes it more accessible, right? Because you don't have to call the doctor's office. You don't have to try to get an appointment with them. You can do that all at your fingertips. So some of the key features, right? So when we think about MyChart, with secure messaging, you're able to communicate directly with your healthcare provider for non-emergent medical questions and concerns. So what that means is there is an option for you to message your provider directly. An example of that I've seen so many different times in the psychiatry clinic, sometimes patients are prescribed new medications and there might be an adverse reaction, right? And so instead of scheduling an appointment to come and talk about those reactions, you can message your provider either using your cell phone or through computer, an easy instant message. And the providers are really good with getting back with patients within 48 business hours. Not only are you able to talk about maybe some adverse reactions to medications, but maybe if you have some questions, right, about some current medications, or maybe one of the things that our providers do is they leave that open line of communication that maybe we need to increase our medication dosage, right, for some particular medications. Or if we just have a general question about anything at all as it relates to your healthcare, you're able to do that through secure messaging. And the only people that can see that message is you and your provider. Okay. Secondly, another key feature, scheduling appointments. How many times have you tried to call your doctor's office to schedule an appointment and you're not able to get in contact with that provider, or you leave a voicemail and it takes them about 2 days to get back to you, right? With a good efficiency of the MyChart is you're able to do that through the app. You can send a message and say, I would like to be seen, give a particular day at a time, and then the person that's reading that message, what we call our CMA triage person, we go directly to those messages and we go ahead and directly schedule that patient if the provider has availability on that day. If there's no availability, what our team does is we reach out to that patient and let them know, hey, we don't have availability for that day, but we can get you in on a different day. Now, different doctor offices work differently depending on who your specialty is, but your ability to reach out to that provider and schedule, and have the ability to schedule through the portal is most certainly a privilege, all right, without having to make an initial phone call. Thirdly, test results. This is one of the things that I absolutely love about MyChart for myself as a patient, right? Because how many times have we gone in to do different blood work or get different tests done, and we're waiting on the lab to contact us? Well, with MyChart, as soon as those results are resulted, you're able to view them in your MyChart. And when I walk you through the MyChart here shortly through my patient portal, you'll be able to see as soon as those results resulted, you're able to access those results. So you don't have to wait on the nurse to call you. You don't have to wait on your providers to reach out to you. Those results are uploaded through your MyChart patient portal so that you're enabled to stay informed about your health, right? Fourthly, prescription refills. You can request those prescription refills and have them sent directly to your preferred pharmacy with just a few clicks away. Now, as the manager of our psychiatry clinic, I assist with those prescription refills. And when I tell you it takes less than 10 minutes for us to complete on our end, once you submit those prescription refill requests, we get it over straight to the doctor. The doctor signs off for us and sends it right to the pharmacy. So you're able to get those medications within 4 to 5 hours of you submitting that request. And of course, like I said, that depends on your doctor's office and their staffing. But I know specifically with our office, we're able to get those requests in immediately and get those those prescription refills sent over so that the patient can get their medication in a timely fashion. And then lastly, the last key feature is health summary. You have an access to your medical history, including allergies, immunization, medications. And here's the great thing about it. The information that's on that portal, it doesn't expire. When we go and log into my MyChart, you'll see that I have information back from 2017. You'll see medication that I have discontinued from 2017, right? And so it's not only up to date, but it keeps a history of it. So if you have to go see a new provider and they need to know, well, hey, what are some previous medications you've been on? Or what are some of your previous tests that you've had? All of that information is inside of that portal. And you don't have to call the doctor's office and ask them to fax it over because you have it at your fingertips. And so with some benefits, of course, convenience, right? And when you think about it, it's a lot simpler to request this information through this portal than having to call, leave a voicemail, and have them to try to call you back, right? Not only do you save time, but you save stress. I know for me personally, save stress. And then also the benefit of, you have the convenience of, if you want to share your health information with anyone through MyChart, you can sign someone as a proxy. If you have children and you want to serve as their proxy, you'll be able to have access to their information. Or if you're a caregiver of someone, you can serve as a proxy. And that's a convenience in itself, because you don't have to get all of that paperwork signed. Once they give you access as a proxy, you'll have that information as well. Or if you want to give someone that proxy information or access, I'm sorry. Empowerment. I cannot express this enough. The fact that you'll be able to have your information at your fingertips. You take control of your health information and your decisions. One of the things that I love about I know I said there's so many things. I know I keep saying one of the things, but another thing that I recently discovered, you can do, you can sign up like for benefits of, if you want to give somebody power of attorney, you can do that through MyChart, and I'll walk you through that process on there as well. But you just have the power to choose what you want to do with your healthcare records and who you give access to those healthcare records. Efficiency, you save time with online appointment scheduling and prescription refills. Communication, you're always connected with your healthcare provider. Not only if you have to send them a message, but if they need to send you a message because they may have a follow-up question after your visit. One of the things that my care team does is they send me a thank you for coming in for your appointment. Here are the notes from that appointment. And then if you have any other question, they give you that contact information. So not only are you able to communicate with your provider, but your provider is able to communicate with you. And then lastly, and certainly not least, in today's society, it's important to know you're secure, right? That your healthcare information is not going to be shared across the internet, or it's not going to give access to someone that does not have the access. That does not need the access. I'm sorry. One of the things that I appreciate about MyChart is when you're signing in from a new device, it's going to send you a code to a cell phone number, and it's going to ask you to make sure that it's actually you by putting in that code that comes to your cell phone when you log into the app. So that's an extra layer of security that MyChart has embedded to make sure that your information is not being shared. What else? I already talked about lab results and things like that, but all of those are great benefits of MyChart. So again, security and privacy. I like to put that slide on there to talk about security and privacy. Your privacy and security are our top priorities. We use encryption to ensure that your health information is protected. Only you and your healthcare team have access to your MyChart account, unless you have a proxy, if you have children or something like that. And then we adhere to strict privacy laws and regulations to safeguard your personal health information. And then here's the pages for you to sign up if you're ready to take control of your health. If you don't have it, I will share this slide deck with Gladys so she can send this information out to you guys so that you can sign up for MyChart if you have not already signed up for MyChart. So I am going to stop sharing my screen for this. Any questions as it relates to the presentation before I pull in my personal MyChart?
I was going to mention that not everybody will have MyChart because different health systems may use different health records. So, but it may be something similar to that. And the way you would access it is call your doctor's office and say, hey, you probably already have it. You just are not aware that you have it, and they can help you with the log on. Just like Lisa's going to send it for MyChart if you are one of the ones that use MyChart. But you can get it similarly, through other ways. Thank you.
Yes. And one of the things that we actually do in our clinic is when patients don't have MyChart, at point of access, point of service, at their appointment, we're able to sign patients up. So this is what our MyChart sign in screen looks like. So you just type in the search engine here, and I also have the app on my phone, but for this purpose, we're going to go ahead and use it on the internet. But it's for you if your healthcare provider does use Epic, and then you do choose to use the app, they have it for the Apple phone as well as an Android phone. And so you'll just put in your username there and then hit sign in. and I was already in here earlier, so it's not going to ask me for that passcode because I've already been in here. But had I not, because I literally was in here playing with it earlier today, it would have asked me for that information. One of the great benefits of it is not only is this information translated in English, but also in Spanish. So it does have the ability to translate the information in Spanish. Okay. All right, so this is the home page that it signs up as soon as you log on. Now, I do want to make you aware I did have an emergency visit here because I had some severe migraine. So you're going to see that information as soon as it pops up. I am on a payment plan, but like I told Gladys earlier, this is a no judgment zone. I'm very transparent and honest. This is what a patient portal is going to look like. As soon as you log in, you're going to see how much you owe because they want to make sure they are collecting their fees. All right. So from this page, you can either pay now or you can sign up for a payment plan, and that's what I'm currently on. And then you can hit view details, and it'll show you what services were provided for that day, and it's going to basically show you your recent payments, all the details, any previous payments that you made, and any communication. So this just shows that the statement that this is how this came back in February of 2023, which was 2024, I'm sorry, last month, okay? Okay, so if you want to go back home, just hit the big logo for Baptist. So these are the other things that I have to pay for. This was for my emergency room visit when I had severe migraines. And so that's the very home screen. On your right side, you'll see some care team and recent providers. So these are the provider offices that I recently went to. Okay, and then you'll see you can schedule an appointment like how I was communicating earlier. You can click this button here to schedule an appointment or to message your provider. So send a message to that provider, whomever that your care team will be. At the very top, they have the quick access button. So if you want to schedule a visit, message, test results, and medications, okay? I want to show you test results. Because a great thing about test results is when you click, so they'll pull all of your test results, right? And you want to click on, make sure you're showing all your hospital test results. So I'm going to click on my CBC, right? It's going to show you all of my lab work. So before the provider reached out to me and let me know my lab, as soon as it results, it was right here in my MyChart patient portal, right? The great thing about this is if you notice, if you see this at the very top right, it says view trends. If you click on any of the test results and you see view trends, you'll see any test results that I've had previously that I've tested before, it'll show you the trends from previous test results, right? So you can see back in 2015 when they took my A1C, that's what it was. And then here it is now. You can do different components. You can select different test results and it'll just show you all on this screen. So you're not having to worry about, well, what was my result last time? Well, sometimes a lot of times your provider says, well, what was it 6 months ago? What was it this way? You don't even have to think about it. Let the computer do the work for you. Let your patient portal show all the information and communicate exactly what it is. And not only can you access it on here, but you can download it as a PDF. So if you need to download it and export it and send it to your provider, or send it to, if you say, let's say you have a new provider that's not within the MyChart Epic EMR system, you can download it and send it to that provider so they can then upload it, all this information into their system. And you don't have to track it down. And then, so that's how you see all of your test results there. They're accessible at the click of a link. Click of a button.
Can I add, Lisa, go back to it for a minute, because I think it's, and I love looking at mine. Like, see, most, like hers are all in green, it would highlight, if you're where the number shouldn't be, it'd be highlighting it, and it would turn red if it's, in the red portion. And all of them are very similar in the way they look.
Correct.
I just wanted to point that out. Sorry.
No worries. No worries at all. No need to be sorry. And then you can also see, to piggyback off her, you can see where you've improved in some of your areas as well. So you might, maybe last year you might have been low or you might have been too high, but maybe you've been working on that with your primary care physician, and now you might be in the green, but you'll be able to track that progress from beginning to end with all of your test results that are in your MyChart patient portal.
Lisa, I have a question. I'm
Yes.
Paul Burks.
Hi.
When I go to see a particular doctor of mine, they will pull the chart up and they will sit there and they'll say your WBCs were normal, your RBC is normal, your ABC is normal, your CDF is normal. What the heck is that? Where do you find what a CBC is and a
Show you what I do.
WRB, etc.?
No worries. Let me tell you what I did. Now listen, well, all I do is double click, right click, copy. I go to Google University. Put that right there, low levels. And it'll tell you exactly what.
And if I can add some of the because I've worked with the EHRs in the past in my former life before coming to the university, and so I'm familiar with other systems as well. If you go in some of the other systems, if you go click and like hover over that the white blood cell count or the H1, whatever it is, if you hover over, it will tell you what it is. So you have to kind of look at your system and kind of figure out what it can give you. But they're all very similar. So thank you. Great question.
Yes, that's a great question. Let me tell you, I utilize YouTube University and Google University all the time, especially if I have the ability to use my phone, because I think a lot of times when you're in those doctor's offices, they use those acronyms and they use a different, the different word, and you're like, what is this? And so never feel intimidated where you can't ask a question. Even if you're in there with them, I encourage you're to be empowered and ask those questions, right? And even if you have to say, hold on 1 second, let me look this up on my phone, because I do it all the time. The great question. So those were the test results. Now we can go to messages. Let's take a look at some of my messages. So remember how I said earlier, after you see your provider, they'll send you a follow-up to your recent visit, and they'll send you a message, and all you do is you click on that message, and then it just basically gives you their follow-up information. They're going to let me know that a survey is going to come out to improve their quality of service. So just be on the lookout for that. What's another message? Providers and primary care officers are able to send different reminders about immunization. They're able to send out maybe different screeners and stuff like that. And it'll all come through your message inbox. But if you want to send a message through your message sender, all you have to do is click send message. And then what would you like your message to do? Either refill a medication, ask a medical question, ask a customer service question, start an e-visit. Now, e-visit, that's basically like a Zoom call or like a mobile, not a mobile, but like a virtual visit, or schedule an appointment. And all of that is literally at your access using your MyChart patient portal or whichever patient portal that you might have, depending on your primary care physician. Looking at the menu, another great thing I love about MyChart, you can do an urgent video visit. So let's say you're having some issues and your insurance covers video visits. You can do an urgent video visit with one of your providers that's on your care team. You can search for a provider, because you might say, well, I don't know who might be in network or who's nearby. You can search for a provider. You can find Care Now. I recently went to the eye doctor and I was prescribed eyeglasses. I don't know how many times I forgot what my prescription was, but in your MyChart patient portal, they'll have your eyeglass prescription. Let's see, continue without saving. So I don't ever have the one, well, what did they tell me? It literally, everything's right here for me. All of my records, my test results, my medications, my plan of care. If I have any upcoming tests and procedures, they'll let me know, track my health. Now, I love that they have the growth chart option. Now, I'm not a child, right? But I do have a 2-year-old, and in their EMR, they have a growth chart. So I'm able to see from each well visit how his growth is coming along. And so that's one of the cool things that I love about Baptist as well with their Epic MyChart. Conditions, genetic end of life plan. This is what I was referring to. So let's say you want to start working on that part of your journey. All you have to do is add any documentation that you might have. So everything will be on file. So at that time, there won't be any questions, because that information will be attached to your MyChart patient portal. And then they also have some helpful resources: Prepare Your Care, Helping with Comforting Care, Plan Your Lifespan. Great resources. What else? Billing. That's another thing. We saw the very first page of the billing. If you have to put any insurance claims through, any referral that you might have, maybe to a specialty clinic, they'll be listed under here. I was talking about proxy access, right? Let's say you have a child and you need to have access to their account because they're your child, or you need to provide proxy access to someone because they're your caregiver. You do that through this proxy access request form. You will fill all of this information out, all of this, and then you would submit it. And then once you receive the login, you'll be able to then become a proxy for that patient, or have a patient be your proxy. What else?
Can you go to your medications?
Absolutely. Medication. Right. So if you are able to request refills, all you do is hit request refills. Now, I'm not able to do this one because this is Benadryl and I'm not prescribed that. But if whatever your medication refills would be, you would just click that button right there, and it'll send a message to your provider that that's what you want. And if, let's say, you just put in list of prescriptions you would like filled along with any comment. So you'll put that, let's say, just Sterling 50 milligrams, and then go next, and then it was submitted. And I'm not going to submit it because I want my provider getting that information, because I don't want them.
No, thank you, Lisa. So here you would have like all the medications you would have. So just that's really important, because how many times do you go to the doctor or to a new doctor or to whatever, and they're asking you for a medication? This is a good way to just have it in one place.
Absolutely. And then you can also patient report if you are no longer taking medications, right? You'll see on here I had some medication from when I had my C-section, from childbirth and stuff like that. I'm no longer taking, even though it was still active. I had to report that I'm no longer taking that information. And all you do that is by doing remove. If you need to patient report any medication yourself, you would just hit report a medication. What else? There was, it was symptom. Hold on. Right? Wait, no, there is it. Does it track my health? There's a way for you to see any requests or schedule an appointment for your annual visits, for your well women exams. Where is the, let's see. And I was playing with it earlier. Find your EVIS, schedule an appointment. Maybe when I do my schedule an appointment. Okay, yeah, that's it. When you do your schedule appointment, you'll let them know what you're coming in for. And that's most certainly helpful for providers, because then they know how to categorize your appointment, and that'll be able to better assist you with actually getting on their schedule. And that is all that I have. Any questions?
I don't have a question, but can you go to, I'm sorry, I'm just curious for something. I'll let everybody take it from here, but I wanted you to show them for a minute I think it was the one under financial resources, financial help, or something like that. Because even if we don't need help, but maybe we know somebody, where was it? Insurance, I saw financial assistance.
Okay.
I'm just curious to see what, okay. But this is a good way for if you know anybody that you're working with, or you're helping, or you're being a caretaker for, or whatever, they may need some. I guess my whole thing for Lisa to share is so that we can take what we're learning here and maybe share with others. So even if it's not us, we know there's this tab here. And similarly in other systems that we can ask for help as well. So I just wanted to bring that up. I'm sorry. Thank you.
No worries. I'm trying to think, make sure I don't miss anything. Oh, visits. So another thing about it, doesn't not only show you, it'll show you like past visits, and attached to the past visits, you'll be able to see your notes, and then your after visit summary, and then any upcoming visits that you might have, future visits, so that you don't have to try to remember when those dates are. Because I know for myself, it's a little hard, because especially when I have a child and he has his own doctor's appointments, trying to manage those schedules can be a little cumbersome. And so being able to see all of your appointments at one glance in one place most certainly assists with my time management. Let's see. And then I believe that is it. Any questions?
This is Sandra Williams. I just got a quick question. Is there anyone, as far as accountability, that I can tell who, and I understood your earlier slide when you talked about security, that only my healthcare provider would have access to the information. Is there anything, a screen that shows like last access or who the user was or things like that?
So that's a great question. As it relates to an organization, we have a legal team that's able to access that information. And so we have a team that's making sure and ensuring that when it comes to accessing patient charts, we're only accessing patient charts that's related to our patient load or that's within our clinic to ensure that a patient is not, an employee is not breaking the glass or not just snooping around a patient's chart. So we do have a legal team that does weekly audits to ensure that.
Ms. Williams, that's a great question. That was the big deal with the how the word leaked out in England with the princess. Somebody was trying to get into her health records, and it was a big deal because I think they got fired. I mean, it was a huge deal, but it's a great question, Ms. Williams.
Yeah, and our legal team is responsible for doing different, like weekly audits to ensure that patient employees are not just accessing patient charts that they do not have access to or should not have access to.
We can get fired for any of that. I mean, we cannot snoop. So correct. I wouldn't ever want to risk my job for, for looking for somebody's information. Yeah.
Correct. It's not worth it.
This is Vanessa Cobra. I thanks for the presentation. It's been really helpful. I got a couple of questions. One, if I'm looking to get a prescription refill and my doctor's not have MyChart, did I understand you to say that if I'm signed up with MyChart, I can send my prescription request to you guys and you would be in touch with my doctor?
No, ma'am. So
okay.
If you have MyChart, then that lets me know that your provider does have Epic. And so when you send your refill request, it's going to tag one of your providers. So the next step would have been tagging that provider. Your provider has to have access to Epic in order for you to even utilize MyChart.
Okay. And so again, that leads me into a second question on that. So the only way I can have access to Epic MyChart is that one of the doctors that I am using, at least one. Okay. Correct. Okay.
As their EHR. Correct.
Okay. Now, the other question I have is, say I have a medical condition and I go to one doctor that has MyChart, and I get their diagnosis, or whatever that is, and I decide I want to shop around.
Second opinion. Mm-hmm.
Second opinion, third opinion. What prevents a second doctor or a third doctor who has access to MyChart? What prevents them from looking at MyChart before I get there to say, okay, so this is what that doctor told you. So that, and not do the work.
Gotcha. That's a great question. So I know I can speak specifically for the psychiatry department within University Clinical Health as well as family medicine. Each time that a patient presents to our clinic, it's a clean slate, unless that patient communicates that they want to share that healthcare information and want us to access that information to see it and use it to assess your patient care. If you do not communicate it, you're going to be like, you're a new patient. We're going to treat you as such. And so we're going to do all the tests to get any diagnosis. And when we have our new patient form, there are questions that we ask on there. Do you have any previous diagnosis or previous? If you don't respond or say anything like that, then we're going to go off what you reported and patiently told us. We're not going to use, because we've had patients that specifically have communicated, I want a second opinion fresh from the start. And that's what we do.
So is that how I would prevent a doctor, say, from looking at MyChart and seeing what another doctor has said to me and say, I'm looking for a second opinion? Yes, because it has happened to me that I go to the doctor already has records, has my records.
Mm-hmm. Yes, I would communicate that on the onset, because you are the patient. You have that right to communicate, I would like a second opinion, unbiased to any previous medical history.
Thank you.
Yes, ma'am.
Hey Lisa, this is Lori. I just want to say I love my portal. I'm with Methodist, so ours is under like a Helo program is the name of it, but I love it. It's like the last time I went and did my blood work, and I'd been working on that A1C so hard, and I was just very anxious to get it. Well, one night about 10 o'clock, I got an email saying something had been loaded. So, I mean, I didn't have to wait till the next morning. I fired up that portal and saw it, and it's like, there it was. And then I was just so happy about it that I was like, then I couldn't sleep. But it was great. I didn't have to wait around on the nurse or anything like that. You can get it there, and I take a lot of prescriptions for heart disease and different things, and it's very easy to manage it and get the refills and not have to go that hassle of calling and all that. So I'm a big fan of them. Love them.
It just makes life a lot easier.
Oh yeah, my cardiologist has a different one, but it's like anything that gets loaded up, I get an email saying something has been loaded into your records in your portal or whatever. And yeah, I immediately load it up and look, and I can see the communication between it all. So yeah, it's great.
And I think I shared with you guys exactly. I did the same thing that Lori did. I think it was last month when we were having this meeting, and I realized once I got off the call late in the day that I got a call from my doctor, and I was like, okay, the nurse wants to talk to me about my lab results. I thought it can't be good. Usually they're not going to call you if the results are good, right? So I'm thinking, oh my goodness, what do I have? What's going on? And I immediately was like, okay, I'm going to go log on. So it was like 8 o'clock at night, and I'm logging on to my chart, and I'm like, okay. And I'm like, okay, some of the numbers are not what they should be, but I'm okay. I don't, anyway, so it really does help a lot. That's why I'm so such a proponent of using and having access to this, because you can look, and I'm like Lori, I love my doing all the diabetes training that I do. I'm always very aware of my A1C, so I'm always checking it from year to year, or I'm always checking my number. So anyway, thank you.
Absolutely. Great question. And I do want to tell everyone on this call, as the patient, you have the authority and the right to communicate to any provider. If you do not want them to access any past information to make a current diagnosis, let them know that you want a diagnosis unbiased to previous doctor's visits or anything like that. As the patient, you have that right.
Yeah, and I also needed to take my blood work results to someone else. So it was so simple. I just pulled them up on the portal, printed a PDF of it, and took them to them. And I'm like, here it is. And they had it right there. And it was only like 4 weeks ago. So it was very current and it did exactly what I needed it to do. And it was just 5 minutes done, moving on. So yeah, I love it.
Well, thank you.
I'm a cheerleader for it. Gladys and I.
Any other questions? Okay. Well, that is all I want to say. Thank you guys so very much for your questions, your attentiveness, and the opportunity to communicate about the benefits of using a patient portal. Again, I will send you this PowerPoint, Gladys, so that you have access to it, so that if you need to share it with anyone or if you need to use it yourself, you are more than welcome to do so.
Wonderful. Thank you so much. I am so grateful.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.